Dr. McDonald, a lot of people are wondering, the J&J vaccine was deemed to be safe, and now we're hearing about 6 women, one who's died, becoming very ill, possibly because of the vaccine. So what do you say to allay fears?
Well, I think what this illustrates is we have a robust safety monitoring system. Like, in other words, you saw a safety alert. In other words, we have a really robust monitoring system through the vaccine adverse event reporting system. You only learn this stuff if you look for it. And so when you do the clinical trials, it's still with a lot of people, but a lot more people get vaccine in real world. So this is what our monitoring systems are supposed to do: detect to see if there's any concern. And if there is a concern, then we can pause and evaluate the concern thoroughly. And that's what's happening right now. It's simply a pause, and then they're going to evaluate the concern thoroughly, and then we'll learn more. And as we learn more, then we can give you a better recommendation of what our future looks like.
It seems very similar to the side effects AstraZeneca was having in Europe.
Yeah, it does seem very similar, and they're similar vaccines in some way. They both have that adenovirus delivery system. So it does raise a lot of questions. And this is why I totally agree that the CDC and the FDA did the right thing. We saw some concerns. We saw that safety alert. So there was time for a pause. And Rhode Island, like a lot of other states, agreed to just implement the pause right away. And fortunately, it hasn't had a big impact on Rhode Island vaccination right now.
Should we have some solace in the fact that nearly 7 million people in this country have received this vaccine, and I hate to say only, but 6 very serious side effects?
Yeah, so, it is extremely rare right now, but this is the point where it's time for that evaluation to occur. And I think it's important for the healthcare community to just make sure that there aren't other people who are affected by this, but also just to do the thorough evaluation. I think, it's interesting. I'm be very curious what the advisory committee immunization practice is going to come up with tomorrow. They're going to look at the data much more closely. And it'd be interesting to see what people learn about this, but it is extremely rare so far. But that's the thing about the robust monitoring system. And part of why I think we just be honest about this is these are new vaccines, but they're being monitored very, very closely. And I think overall, this should instill a fair amount of confidence in the American public about what our vaccine safety looks like. Because right now it's like, this was a pretty big decision. You're taking a vaccine offline during a pandemic, but that's because vaccine safety is top priority in this country. And that's just an important message for everybody to understand is safety is the top priority right now in the United States and in Rhode Island.
What's different from the adenovirus vector vaccine from the mRNA?
So they're different delivery systems. The messenger RNA system is surrounded by little fat molecules. It goes into our arm, and it tells our cells in our arm to make the spike protein. Our body makes antibodies. The adenovirus is a virus that we might get infected with, but it's a weakened one, and it sends a different message to our immune system. We're not really sure why there might be a concern there. That's what has to be studied and understood more, but they're totally different delivery systems. It is important to note, though, that these concerns have not been identified at all with the messenger RNA vaccine. So the Pfizer Moderna vaccine do not have this association with them just yet. And that's something that's just interesting. And this is why this needs to be studied more robustly to understand what this is really all about, if there's anything there at all.
Any idea why it's impacting younger women? We're talking 18 to 48 years old, maybe even, a little older. The AstraZeneca, I believe, was 55 and younger, but any idea why women in particular?
Yeah, so far it's only 6 people. So I don't think we can draw any conclusions about that right now because it's really too early to tell at this point. So we'll have to learn more and see what we can find out about this.
What advice would you have to people who've already received the J&J vaccine, maybe in the last few days, last week?
Yeah, so if you've gotten the J&J vaccine in the last few days, last week or two, you're probably going to be fine. These are extremely rare phenomenon that are occurring here. The people who are having problems got a severe headache. It's often called a thunderclap headache. You don't really need to know what a thunderclap headache is to know what it feels like. It's pretty aggressive. And those things are the very severe findings. It's not people have had the typical immune response where you feel like you have a mild flu-like symptom. If you feel like you've had a mild flu-like symptom, that's just the normal response there. But if you have any concerns, call your doctor and have a conversation and see what makes sense.
And should this dissuade people from getting any vaccine? A lot of people might use this as, vaccines can cause issues.
Yeah, I think what this actually signals is the opposite. I think what it signals is we have a really robust monitoring system. And I think what it shows you is that the United States is very serious about our vaccines being safe and effective. I think if anything, this should reassure the public that we're going to do whatever it takes to make sure your vaccines are safe and effective. And if it means taking one of them offline while we pause and figure out the problem, then that's the right thing to do. That's a pretty courageous decision that occurred from the FDA and CDC today. During the middle of a pandemic, to take a vaccine offline, it's the right decision, but it was a courageous decision.
Do you feel optimistic we have enough vaccine out there?
Yeah, it's not going to affect Rhode Island's supply right now. We only had 2,000 doses planned this week. Because of that problem in the Baltimore plant, we were down all those J&J vaccines anyways. So it's really not going to affect our supply meaningfully. And so right now we still have the Pfizer vaccine and the Moderna vaccine. And, keep in mind, the Novavax vaccine will be in front of the FDA in the next month or so. So we'll have to see what that has to offer. That's a possibility as well.
And what do you say to people who were supposed to get the J&J vaccine today or in the next few days?
So we've tried our best to reschedule you or keep your appointment and have a Pfizer vaccine or Moderna vaccine waiting for you. In other words, we're trying not to cancel anyone completely and offer people a different vaccine that we have there. So hopefully those folks can still just say, I'm going to show up for my vaccine appointment and get a vaccine. It won't be the J&J one, but either Pfizer or Moderna. And those are safe and effective vaccines as well that we're very confident with.
Anything else you'd like to add?
I think the main thing is, at a moment like this, you can look at this one of a couple different ways. One is, oh my gosh, something happened. I look at it more like, I'm really glad we're keeping close track of this. Say what you want about vaccines, but they're very safe, very effective. And our country looks after them very, very closely. In our country, vaccine safety, not just with COVID vaccines, but all vaccines, are very robust. And our country takes vaccines very safely because we really understand preventing disease is really important. But you have to have confidence in the vaccines you get. And that's something that's very important to Rhode Island and to the United States.